All right, welcome everybody. Thank you for joining us for First Friday Forum. There are certainly a lot of concerns, a lot of questions about healthcare in Taos. We're going to leave plenty of time at the end of the program to have questions and be able to talk a little bit about what are some of the specific concerns from the business community, from Holy Cross Hospital, and see if we can get all those questions answered. Andrew Black is from Senator Bigeman's office, and we want to not only hear what he has to say, but then have some questions prepared so that anything that you have questions on in your mind, kind of have that prepared so that after his remarks we can have a little lively discussion here. Here is Andrew Black.
Good afternoon. It's an honor and a pleasure to be with you all here this afternoon. I do want to take some time actually to introduce my colleague. Many of you know Janelle Frederick. She covers Taos County exclusively, so everything from cradle to grave that happens in this county, Janelle is your woman. Also, on any difficult questions that you have for me today, Janelle is your woman. So with that said, I have the enormous task of trying to conquer a 1,200-page law in about 45 minutes. So I will kind of move forward with that task. But I think it's really important for me to give you just a touch about my background, and I think that'll also speak a lot to how I see this law with regard to the importance of understanding this within community, understanding this within a broader moral picture. My background is I'm actually an ordained Presbyterian minister and also a lawyer. Some people say, does that make you a kind of a streetwise preacher or an honest lawyer? Hopefully I'm both. But with that said, I think that when you talk about healthcare, I think that you really fundamentally get at issues of community. And so let's go ahead and begin. And I want to kind of begin by framing it in this way. And I want to begin by framing it with a quote from Martin Luther King Jr. And some of you may have seen a little, me present before up here in Taos. Some of the presentation today is going to be similar to what I presented on, but I've also added some new material. So there should be some new stuff if you haven't seen this. But with that said, I do want to start with this quote from King. He said, "Injustice anywhere is a threat to justice everywhere. We are caught in an inescapable network of mutuality, tied in a single garment of destiny. Whatever affects one directly affects all indirectly." Though spoken from a Birmingham jail in 1963, King's words are as relevant today as they were nearly a half century ago. Over the past year and a half, Senator Bigeman and I have been traveling around the state meeting with healthcare patients, providers, and family members of those who are sick. We've met with seniors, and we've met with children. We've met with the uninsured, and we've met with the underinsured. We've met with hospital administrators like Peter. We've met with also local, state, and county health officials. We've met with small business owners. We've met with community health directors such as Lore. We've also met with various community leaders, from everything from school-based health clinic leaders to nonprofits that are in the community that are providing some form of healthcare services. And not only has the reality that what affects one directly affects all indirectly become increasingly apparent and evident in these conversations, but also how healthcare reform strikes at the very essential questions underlying King's assertions here. Questions like, what does it mean to live together in community? What does it mean to care for one's own neighbor? What does it mean to understand oneself as interconnected, to care for those who are sick, who are elderly, who are children, who are veterans, and ultimately who are the most vulnerable in our society today? And I think it's in wrestling with these very questions, not only did our office and the Senator gain a deeper understanding of this network of mutuality that King speaks of, but also just how the injustices within our healthcare system were endangering the health of individual New Mexicans, causing harm to the well-being of New Mexican families, and ultimately threatening the very fabric of justice in our nation today. So before we get into the nuts and bolts of reform and what all the specific components and the main components that every New Mexican should know about healthcare reform, I want to look at some of these injustices from a coverage, affordability, and economic perspective. So prior to reform, 1 in 6 Americans had no health insurance. Between the years of 2000 to 2007, a 7-year period, the cost of health insurance skyrocketed nationally, with premiums rising nearly 80%. At that same time, though, wages only rose 15%. In 2009, 1 in every $6 in the American economy was spent on health care. And by 2016, without health care reform, it was projected that at least half of all American households would be forced to spend half of their income on health insurance. Let's talk about New Mexico. In New Mexico, prior to reform, 23% of the people in this state had no health insurance. That's about 400,000 New Mexicans were lacking health insurance. The only state with a higher percentage of uninsured was Texas, at 24% nationally. It's estimated that 80 New Mexicans every single day lost their health insurance. New Mexico also has the highest percentage of uninsured workers, meaning that more often than not, people who are working are not getting insurance through their employer or still can't afford it through their employer. Those of us with insurance also know that insurance rates and premiums continue to escalate at unsustainable and unacceptable levels. In the year 2000, the average insurance premium for a family of 4 in New Mexico was about $6,222. So that's just 10 years ago. By 2006, this rate nearly doubled to $11,279. Even more alarming is the fact that without reform, by 2016, the average family of 4 in New Mexico was projected to pay $28,533 a year in their premiums. How many of you know New Mexican families that could pay $28,000 a year in their premiums? Anybody? Most New Mexican families would find that abhorrent, unsustainable, and unacceptable, and so did our office. And I think that you have to understand those realities to say, we need to do something, we needed to do something. And I think you have to understand that context. The fact is, New Mexico has the highest insurance premium rate escalation in the country. Our rates go up faster than any other state. So, with that said, as you know, Senator Bingaman was a strong proponent of health care reform, and the senator believes that the law is a step in the right direction that is going to greatly benefit our state and our nation. So what is this law known as? The law is known as the Patient Protection and Affordable Care Act. And the law as a whole is going to greatly increase health care coverage for New Mexicans. And what I'm going to do right here is basically, sorry, I'm getting some feedback from the back. Basically, our job is to, right here with this next couple slides, is kind of present the umbrella of what are the overarching goals of health care reform. What were the policymakers trying to get at and deal with in terms of creating a law? And, how do we understand that with regard to the specific components that I'm going to talk about? So just to put it in a more understandable manner, it'd be like showing you the forest before we take a walk through the trees and look at the specific components. So, as you can see, the law is going to greatly increase health care coverage. Here's before the law is enacted, and this is after the provisions take effect. If you notice, the two biggest increases are going to be persons covered by Medicaid in the Children's Health Insurance Program and persons covered by private insurance. You can see the escalation from 38 to 53% in private insurance and from 22 to 29% under Medicaid. That's the expansion of coverage. We're predicting that this law is going to result in the coverage of 95% of New Mexicans and 95% of Americans. That's according to the Congressional Budget Office. What else is